All right, people are going to come in.
Right. Good morning, everyone. We're going to get started here in just a moment. And you should be muted on the way in, but if you aren't, it's good to kind of stay muted so then that way everyone can kind of hear each other and hear all the presenters and everything. And thank you so much for joining us this morning. Okay, well, I think we are going to go ahead and get started as we want to be sensitive to everyone's time. I want to thank you all for joining us this morning. It seems like it's early for me just because I haven't had enough coffee. So for a Saturday, so thank you so much for being generous with your time and joining us. My name is Clint. I'm going to be moderating the discussion this morning. This is being recorded, so just want to bring the awareness to everyone because we want to make this accessible for other people who may not be able to join this morning. So we're going to try to make that recording available for everyone. These forums and town halls are great for our community because it gives us an opportunity to connect with our elected officials as well as our government officials on such a serious topic for our community and globally. And we're going to be talking today about COVID-19, the Delta variant, and vaccines. So three big topics. If you've never joined one of these forums before, we have a lot of familiar faces and we love seeing you every time we have a forum, but we also have some new folks joining us today. So if you've never done this before, sort of the way the format works is we're going to have our elected officials make some opening comments today. And then we also have a special guest joining us today, and he is Tom Gonzales from Larimer County, which it's great to have so much great knowledge and panel expertise for a conversation like this morning. He's going to do a brief presentation, and then we're going to open it up to Q&A. We have some questions. I had questions submitted to me in advance. You will all have an opportunity to either chat in your questions, or you can be able to ask questions live. So that's kind of the fun part, that we can be able to ask all these great folks some very specific things. So with that, I'm going to go ahead and we're going to just jump right into some opening comments from our legislators. So I'm going to ask Senator Ginal to kick us off, please.
Yes, thank you. Clint, thanks for being a facilitator today. And thanks to my colleagues, to Arthur Kipp, who's also part of the group here that makes these things happen. And thank you all for being here this morning. It's an extremely important topic. I think one that we have been dealing with for a year and a half, maybe more at this point. It's kind of losing track, but COVID-19 is still around, and you know, the pandemic had its ups and its downs, and we had a little bit of a, I don't know if you want to call it a break or not, but the situation now has changed where we have an uptick, and I am very concerned about this new variant, and I am not going to take up much more time because I want all of us to hear about it and what it's doing to our hospitals, to our nurses and doctors, and to the patients that are being affected, as well as other groups that Director Tom Gonzales will be talking about. So I just want to say thank you for coming onto this forum this morning, because you are all aware. Hopefully you will spread the information that you get, spread this information to your friends and family and anyone, because it's so important to know what is going on with this Delta virus or Delta variant and with the COVID-19 virus. And with that, I'm going to send it over to Representative Kipp.
Yeah, and I don't really want to take much time either. I just really want to tell everybody thank you for joining us this morning. I think this is a really timely topic given where we are in the pandemic and, you know, just this really deadly variant that's going around. And I just want to say that actually this is Flint Kipp, but his twin brother is Arthur Kipp. So I can totally understand the confusion there. So, but thank you to Clint for moderating, to Tom Gonzales for joining us here today to make sure that we're able to keep everybody informed and answer everybody's questions. So thanks.
Representative Boesenecker.
Well, thanks. And thank you, Clint, for moderating today, and wonderful to be alongside Rep. Kipp and Senator Ginal. And just a special word of thanks as well to Tom and his staff. You know, I think we thought we were through this. We still have more work to do. There's still more things we can do proactively as a community. And I just want to thank Tom for making the time to be with us today to really share some of those vital next steps that we can take as a community. And also really a shout out to our frontline medical workers who are beyond taxed and stressed at this point. And so we are, of course, grateful for the things they continue to do to protect the health and welfare of our community. So with that, I'll turn it over.
Awesome, thank you. And again, I want to echo that. Thank you to all the legislators for making this possible, and Flint Kipp for being my co-pilot today. When you're moderating and then you're trying to co-pilot, really appreciate all the help there. So it is my honor to introduce Tom. Let me switch over here. Tom he's currently serving as the public health director for the Larimer County Department of Health and Environment. Tom holds a Bachelor of Science in Environmental Health from Colorado State University and a Master's in Public Health from the University of Northern Colorado. And he is also a registered environmental health specialist. And prior to joining the county, he was a deputy public health director at El Paso County Public Health, overseeing emergency preparedness and response, environmental health and laboratory. So Tom, I know you are really busy currently with everything that's going on with not only COVID, but vaccine and also with the hospitals and everything. Thank you for joining us today because I know your time is very valuable. So with that, I'm going to hand it over to you. Thank you for joining us this morning.
Well, thank you, Clint. Thank you, Senator and representatives, for having me on this morning to talk about COVID-19 and the situation we're currently experiencing here in Larimer County and throughout the region. If I could share my screen, Clint, I will. I do have a slide deck. We'll go over those and then we can certainly open it up to questions. Let's see if I can do this quickly. Great. We all see my slide deck.
Yep.
Okay. Well, let's see if I can get the. All right. Well, let's talk about, you know, back in May, early June, we were so excited. CDC had announced that those that had been fully vaccinated could remove the mask indoors, still recommended for non-vaccinated. And we began living a somewhat normal life with little masking, little to no social distancing. Our businesses were expanding their occupancy. We were enjoying ourselves. It was kind of a roaring time. We were very, very excited where we were going. What happened? About in late June, early July, Delta came to our region. And that's really what's caused the difference. That's the changing conditions. The Delta has tipped that weight, that scale, and is now causing severe complications, not only in Larimer County, Colorado, but the United States and the nation. So when we talk about what the change is throughout this morning, it's that Delta variant. And we're going to talk, what is that? What is that difference? And I hear from people daily, Tom, it feels like the goalposts have been moved. What's this? It's this Delta variant. This virus, this SARS-CoV-2 virus, is like no other virus. And it has been able to mutate into this Delta variant that is really, really causing challenges, especially in our hospitals. And we'll talk more about that. So what's the big difference with the Delta? You've all probably seen this, but the Delta is extremely more contagious than the wild strand and even the Alpha strand that we were dealing with in April. And put that into perspective. The wild strand, that initial COVID or SARS-CoV-2, what we would see through contact tracing is one person would potentially spread the virus to 1 to 2 people. And that's pretty significant. That's even higher than flu. But this Delta variant, what we're seeing is it's 3 to 6 people, 1 person. So put that in perspective, the spread of this virus is exponential. It's just really moving through the community. And what we're seeing predominantly in the unvaccinated population. We'll talk more about that now. There have been breakthroughs. There is a percentage of breakthroughs. Those are where the virus does cause symptoms. You get impacted, but the symptoms are a lot less than those that are vaccinated. But for the most part, this is now a non-vaccinated epidemic that we're seeing throughout our community, and it's because of the simple contagious nature of the virus. And another key element of this virus that's really concerning is early on in the virus life cycle within the person, it impacts the person very quickly, replicating within the cells, the human cells, and produces a large viral load within the nasal and oral cavity, really within day 3 to 4 or 5. What this causes is the person's to be contagious 2 days prior to even showing any symptoms. 2 days. So you could be out in the community spreading the virus. You have no idea you even have the virus. The difference from the alpha and the wild was the alpha and wild were about 1 day where you had this contagious. Well, the Delta's doubled that as well. So that's really concerning as well. So where are we at here in Larimer County? Recently, we've jumped up in our case rate to 229 per 100,000. That's a 7-day case rate. Put that in perspective, back in early June, we were down to 22 per 100,000. So we have significantly increased there. Well, let's look at percent positivity. That has been a really good indicator throughout the pandemic. When we see the percent positivity go up, usually our cases go up and unfortunately hospitalizations. If I can put one hope out today is our actual percent positivity has slowly dropped over the last 4 to 5 days from about 8.1 to 7.6. Hopefully that's an early warning sign that maybe we're going to maybe come down. That's a hope. But the 7.6 is significantly up since June, where we were at 2.1. So we have a high percent positivity. And the percent positivity is much higher in our younger population. Of course, those that cannot be vaccinated just yet, those that are under the age of 12. But what's really concerning is down here, our hospital situation. Currently have 66 COVID-19 patients being treated in our 4 hospitals. But right here is the concerning. You may have read it in the front page of the Coloradoan. Thursday, this number was 100% ICU capacity. Now, what does that mean? It's really complex in hospitals when we're talking ICU, and I've learned a lot through the pandemic. But in Larimer County, we have 81 intensive care unit beds between our 4 major hospitals. Now, those that can expand up to 105, and even at the peak of the winter wave down in December, January, they got up to about 120. What that means is you take progressive care beds and you move them to intensive care and you expand. But it doesn't mean all of a sudden you have more beds, essentially. It just means, what is that bed going to be used for? What type of care? So right now, what we're hearing from UC Health is they're at 120%. So that means they moved those progressive care beds up to intensive care. Literally every bed is full of somebody, and 40% of those people in ICU are are battling COVID-19. That's very significant on our hospital load. Now, what's compounding all of this is our healthcare worker shortage. The skilled physicians, the skilled nurses in intensive care, they don't have as many as we did in December. They're tired, they're exhausted. So even if we add beds, there's not a person there to care for you. So right now in our hospitals, they're overwhelmed. The situation is very, very concerning. And we have got to make sure our community understands the severity we're seeing in our hospitals. Because what does that mean? That means if all of the beds are full with patients, and 40% of them are COVID-19, and now we have a major car accident on I-25 with lots of trauma, we're going to have to transfer these people somewhere else. But when you look elsewhere, their hospitals are full too, like in El Paso County, the southern part of the state. Denver is seeing an increase significance as well. So the state has opened up their combined transfer protocols through an executive order through the governor. But where do you put people? Because other places are full as well. We haven't reached that tipping point just yet, but we're getting really close, and it's very, very concerning. So we're going to have to change our behaviors to reduce the pressure on our hospital systems. So we're at high risk level. What are those recommendations? What are those behaviors? Get vaccinated as soon as possible if you're not. The vaccine's saving lives. It's a preventable disease. You know what? I totally agree with you. You want to know what you're putting in your body or your children's body, please talk to a trusted person, a medical person, your doctor. You can certainly call us. I can get you in touch with Dr. Mayer, our medical officer. We can have those conversations. We want to have those conversations. We want it to be the easy choice to get vaccinated. We want to make sure you understand what it means to get vaccinated with the mRNA or the one-dose J&J. For now, I'm urging, pleading, begging everybody to wear a mask when you're indoors. It reduces the spread throughout the community, thus reducing the pressure on our hospitals. Monitor yourself. Make sure every morning you see how you feel, even if you're vaccinated, because you could be a breakthrough. Let's check. How's your throat feeling? Do you have a cough? Do you have a fever? Those kind of things. If you do, you need to stay home. The more people we have out sick, the more spread of the virus. We are recommending postponing indoor gatherings or consider vaccination, moving activities outdoors while it's still nice, minimizing the number of households within that activity. I know that's a step backwards, but we certainly need to make these changes, at least short term, to reduce the stress on our hospitals. We're encouraging all our businesses to go back to remote work and practice social distancing. And we're working with all our wonderful businesses that have made many, many sacrifices to use best practices to reduce transmission, whether that's ventilation, air circulation, upping in their sanitation, requiring vaccinations, whatever it may be. There's multiple layers of strategies that they can use to reduce the transmission with indoor settings. Let's talk vaccinations. We saw quite a decline in the number of vaccinations per day on our 19 providers here in Larimer County. When I say 19 providers, that's our hospital systems, our health department, the pharmacies, FQHCs, everybody giving vaccines. We kind of hit a lull here, but now we're starting to see an uptick. We're hopeful this keeps going up. People to make the choice to get vaccinated. It's our biggest tool, our weapon to get out of this pandemic. Where we see areas where they have higher vaccination percentages, the amount of hospitalizations and percent activity is much lower. So we know the vaccines work. So we're encouraged to see first and second doses going up. We are giving third doses for those that are immune compromised. That has been approved by FDA and CDC. So if you are immune compromised, please give us a holler. We'll get you some information. We'll get you your third dose. We are learning that middle of September, boosters will become available for those that early on got the mRNA, are 75 and up, our healthcare workers, our first responders, so they will be able to get a booster. We're hearing very, very encouraging results with the booster, really upping the immune system. So those are exciting as well. You know, throughout the pandemic, we've talked about, boy, we need to get the percentage of people vaccinated. And we've reached that 70%, at least one dose for all eligible people. That's exciting in Larimer County. That's over 415,000 shots in the arm. Fantastic, amazing work with just really a team effort. But with the Delta variant, it needs to even be higher. We need to get to 80, 85%. What does that mean? That means about 30 to 35,000 more people to roll up their arms. That would really, really put an impact in our kind of a herd immunity, plus the natural immunity from people that have suffered from the disease. And are in schools, we value in-person learning so much. We want our kids in school safely. We really need to get the 12 to 17-year-olds up to 70 to 80%. This is a goal that the CDC and the State Health Department are putting together. So what does that mean? 4,000 to 6,000 more shots in the arm in that age group. So it really does mean increasing our vaccine. We're seeing about 400 to 500 shots in the arm a day in Larimer County. So the vaccine continues to happen, and it's exciting. What is percent by age group? Middle school age, it's a little difficult here because sixth graders for the most part aren't eligible at 11. We are hearing Pfizer will be getting in their paperwork to FDA here soon in the next week. The FDA will take their good thorough work, 3 to 4 weeks. So we're hopeful by the end of September, we hear the news about 5 to 11-year-olds, and hopefully they'll be eligible for the vaccine. So this number would significantly change. Our high schools, we'd love to see that up in the 70%, but we're slowly moving it on up. And our adults, like I said, we're doing a good job here in Larimer County on the vaccine. I'm so proud of the work, but with the Delta variant, we need to be even higher. What does it mean when you're vaccinated in our hospitals? We get hospital data daily. It means if you're fully immunized, your chances going to the hospital are pretty slim compared to those that are not. And this is just data right we get from the hospital. So please, if you can, you're eligible, get vaccinated. If you have questions, contact us, a trusted medical partner, call us. We'll certainly sit down and have a conversation. We've had questions about, race and ethnicity. How are we getting this vaccine out equitable? That's a fantastic question. We are lagging in our Latinx population, and that is really bothersome. And we're working hard to come to the communities, hear from the communities. What are the challenges? What are the barriers? What's the access issues? So we have been popping up what we call equity clinics. Recently, we had a couple of successful clinics at Poudre Valley Mobile Home Park and Harmony Village, where 113 first doses were given. We're at our schools. We were at Rocky Mountain High School this week. We were at Loveland High School. We're going to be up in Estes Park next week. We're going to be up in our rural mountain communities as well to bring the vaccine to them. And we'll just, if you have other ideas, there's a number here. We'd certainly like to get ideas on where we can come to better reach our community, get that shot in the arm. We understand barriers are very different from spectrum throughout our community. So we want to meet the folks halfway or wherever they can be. That's really kind of the presentation here. I threw a lot of information out there, but if you have questions, we do have a joint information call center up Monday through Friday, 9 to 4:30, that 498-5500. You'll get a live person. We have about 8 people working around answering the phones. You can text anytime. We usually have somebody manning our text line if you have a question about vaccine. Email, and then of course you can visit our website and our dashboard and get a wealth of information from there as well. With that, I will turn it back to Clint.
Thank you so much, Tom. I really appreciate that. I'm just going to go ahead and switch back over here real fast. And everyone should see the slide. So now we're getting to the fun part, and that's the Q&A. And this is the part that I like the most because I really like interaction and asking questions about these topics. And thank you. Some people have already submitted in questions, so that is wonderful. We have 2 ways of handling questions. So one is you can chat me a question. So you can just make sure in that little chat box that you have, it'll say to : and you just want to make sure that my name is selected, and you can go ahead and chat your question. If you want me to read your name out loud, you can, just say, this is Clint and this is my question. We always love to attach names to it. If you want to be anonymous, just post your question inside there and I will try to get to all of them. If you want to ask a question live to either Tom or to our legislators, raise your hand, and then my wonderful co-pilot will be helping me. I can go ahead and call on you. You can unmute, ask your question, and then we just ask that you mute yourself afterwards so it gives people an opportunity to weigh in. Also, we don't get background noises. If you're anything like my neighborhood, we have dogs barking in construction and all that kind of fun stuff. So that's sort of our format for questions. We will try to get to everyone. And we also want to allow some time at the end for some closing comments from our legislators. So I'm going to keep an eye on the time as well. So that's sort of our format. With that, we did have a question, and again, I'm going to summarize the questions as they get chatted in. We do have a question from Emily, who is asking about mandatory mask mandates. And I think this is a great question because we have guidelines and we have mandates. And so, and I know that earlier on in the process, the CDC came out with, we really have this, we have the CDC, we have Surgeon General, we have lots of people weighing in. So a question for you, Tom, are we going to see some mandatory mask mandates coming down?
Yeah, I appreciate that question, Emily. First and foremost, we're trying behind the scenes to get businesses and our municipalities or schools to implement mask requirements, indoor mask requirements. I have strongly urged that we all go indoor masking. There's a challenge when you say mandate versus let's work together. And I feel that if there's a point where the pressures on the hospital is too significant and we're not getting that buy-in, that behavior change with masks, certainly that's a conversation we have to have. But I would really like for us to do it together, not mandating certain things. But if we got to some situation, I've said from the beginning, it's all about our hospital's ability to care for all, then we will have to have a conversation regarding that. So thank you for that question.
Thank you, Tom. We have a hand raised from Sarah. Sarah, would you like to ask your question?
Yeah, thanks for the opportunity. I have two quick questions. So one, I was wondering about whether there will be availability of free rapid COVID tests for the public. Right now, if you're a parent trying to test your kid, it's really hard to even find stock anywhere of the sort of rapid tests to be available. And you can go and do the drive-through, but then you have that sort of long delayed wait. I also know some parents who are trying to do this regularly for a variety of reasons, and it's just extremely expensive, right? They're spending $50 a week on these sort of rapid tests if they have a mixed family. So wondering, I had heard something from Polis a while ago about the possibility of having free rapid testing through schools and wanted to hear about the progress. My other question, and I'm sorry, I don't want to take too long. It's a follow-up on the other one about mandates. And I fully respect how difficult it is to mandate this. And I'd like to just suggest that daycares are not complying. Many of them are implementing mandates for adults. Very, very few private daycares are having the under 5 crowd mask. So, that's leading, as a parent, I went and checked and thought, well, Pooter's masking, maybe I can get on a wait list for early childhood. There are no openings in early childhood for kids under 5, huge wait lists. And even then it's this partial day care, right? Where you can get 3 hours of care a day. So if you're a parent who needs 8 to 5 care, finding a childcare provider who will mask your kids throughout the day is incredibly difficult. So I don't know if there's anything that can happen with messaging for daycare providers. They're still using the language of strongly recommended. And they say, parents, you can send your kid in a mask. But what I've heard from our daycare provider, who I really deeply respect and think they do wonderful work, they've just said it's really hard for them to implement those rules without a mandate from the county. And I also understand it's really hard for the county to mandate it. But I just wanted to voice that concern that I know a lot of parents of young kids are experiencing right now.
Sarah, thank you for sharing all that and your story on that. I empathize. Yes, we meet with our childcare centers. We can do a better messaging and we can come up with some better strategies when it comes to face coverage. We are seeing some spread in our childcare. So it's concerning to me. So absolutely, that's something we're getting on Monday. So thank you for that with the childcares. Rapid testing, yes. The state had received some ARPA money for the relief funding that was supposed to have been rolled out a little earlier, but the contractor situation just got established. So my understanding is Thompson, Pooter, other schools are ready to go, and we will be providing that free rapid testing. And I can't wait for that to happen, but that should be soon. More information to come out. And we'll make sure we send that in a media release and put it on our Facebook so you all see that. But that is something we're very excited about, and we can't wait to get that out to everybody. So yes, thank you.
Thank you.
Thank you, Sarah, for that great question. So Tom, Early on, when the Delta variant first came here into the US, there was a lot of very hopeful information that those that were vaccinated had it was a very high percentage of effectiveness. Over the last couple of months, as COVID information and Delta variant information starts coming out, we start seeing that percentage change. I think early on it was in the 84% saying if you're vaccinated, you with that 80%, you're pretty good. And we've started seeing that information slowly shift over the couple of months where it's like, it's definitely, the vaccine's not a shield, but it will prevent you from the most severe symptoms of the Delta variant. Could you share with us a little bit about that? Because certainly a lot of information out there. It's like, oh, I'm bulletproof as long as I have the vaccine. But we're seeing these public health orders and initiatives saying, we still want you to be, cautious. Could you talk to us a little bit about that?
Yeah, that's a fantastic question, and it's one that it's a lot of conversation around it. And we're trying to get our hands around it with all the studies going on. But two things are happening with when it comes to fully vaccinated individuals in the Delta variant. We are seeing early on, those that got the vaccine very early, January, February, March, so we're eligible. We're seeing a little waning of the vaccine within the immune system, that the Delta variant is taking, it's latching onto that. The Delta variant with its high viral load, it's just, the wild strand and the alpha, half the load of the virus. So more virus, more impact, the more your immunity, your little army in your body has to fight it. So that wasn't, that's something new too. So you compound those two factors, certainly those that have immune compromised symptoms. That's why we immediately are giving them the third shot to combat that. And we're looking at, if you're more than 8 months out from your second dose, you're going to need a booster. So that has been definitely confirmed. And now with J&J, they're also putting together a booster. So it is frustrating because this darn virus, it just keeps finding a new angle at us. The good news is, when we look at the hospitalizations, when we look at the severity, those that are in the ICU, I haven't said it, ICU, the data coming in right now from both Banner and UC Health is only 7% breakthrough through ICU. And those are usually immune compromised. That's why we needed to get them the third shot. So if you're immune compromised, I haven't got your third shot, let's get it to you in you now. So those are things we're looking to combat it with the booster and the third dose for immune compromise. But yes, the Delta has put another twist when it comes to the vaccine. One thing we're seeing through some studies that are coming out of the CDC, even fully vaccinated, there is a small window where if you're a breakthrough, you can be contagious. What does that mean? That means I'm fully vaccinated. It means I get exposed to the virus. It's about a half a day to a day. I could be contagious. That's why I'm now making the recommendation, everybody wear the masks again, because of that potential with the Delta. It's very slim, but there is that potential. So that is, it's frustrating. I'm with you, but hopefully we can get these boosters or third shots and the boosters in as soon as possible and get more vaccinated to minimize these breakthroughs.
Thank you, Tom. Again, to everyone who's joining the forum, you can ask questions one of two ways. You can raise your hand and you can ask a question live. Also, if you want to chat a question to me, just make sure in that little box you select me, and then I'll add it to the question bank. Tom, I have another question for you. So the Pharmaceutical Journal recently, wrote an article about vaccine hesitancy, and they sort of conceptualized 3 ideas, sort of the 3 C's, and this is changing. It's like confidence, complacency, and convenience. So confidence, the lack of trust, the safety and effectiveness of a vaccine; complacency, perceived risk of the vaccine, and its ability to actually prevent, and convenience, affordability and access and those type of things. Can you share with us kind of what is the county doing to help those with vaccine hesitancy so that they are more informed, and that you've spoken about in your presentation about talking to your healthcare provider, but what are sort of the steps that the county is taking to make sure that they get this information to this population?
Clint, I think that's a really good article on health officer, Dr. Mayer, has read through that and is coming up with some strategies based upon that information. So that was a wonderful read. First is accessibility. That's where we're doing all the pop-up clinics and coming to people. That has been successful. The days of 1,000 dose clinics at the ranch that we were enjoying, they're down to 30, 25, 10, whatever it takes. So we've got about 3 vaccine clinics that my deputy director is overseeing, and any day there are various places throughout the county, like I said, schools or at a mobile home park or at a festival. We're at some festivals today. So that's just bringing it to the people. Secondly, is this complacency. That's where we look at the health belief model where, hey, I think I'm going to be fine. I don't think this virus, it'll be just a minor cold. What we're really trying to make sure they understand is how you can transmit that to maybe somebody that is much more vulnerable. So it's a tough sell, and we're really trying to figure out strategies on how we share to them that now you could spread that and so protect your neighbor, your family, those kind of things. And so we've got an outreach team of about 6 to 7 trained individuals that are going out to communities and are available to come to if you're having an event, and have those conversations. And really it's about how the virus spreads and how you now can be the spreader, and then you can get grandma sick or an aunt or a loved one. And then there's those that are really concerned and want to understand what is in this vaccine. And that's where we get Dr. Mayer in, and that's where we have our medical team to really talk about the specifics on the medical side of that and have those conversations. We find those conversations are better one-on-one and private. We want to have those. There are side effects that we gotta be transparent about the vaccine. And I think those conversations are very important. And we're working with also our family physicians, our docs in the community to get everybody together to have those conversations. So I think it's a 3-pronged approach, like you said. I think the one that's more intensive is the actual one-on-one conversations, but we find those to be very valuable.
Thank you, Tom. Another question that came in, this is kind of a 2-parter. As we enter into flu season, local governments and businesses are going to be engaging in flu shot clinics. And so one of the questions that came up is, do you foresee sort of a partnership as flu season is also very serious, and local governments and businesses have been doing this for a while? Do you see any sort of partnership in regard to also maybe these organizations providing COVID vaccines at the same time? And as a follow-up, is there going to be testing available at the ranch in Loveland?
Okay, let's answer this. Yes, we are already in conversation with the state health department, with CDC in the White House. How do we do flu, booster, and your first dose all together, and not in one shot, but in one setting. So we are already in the works of getting those rolling out, hopefully in October-ish time. You can come and get your flu shot, get your first dose, your booster, whatever it may be. So that is exciting. I know our nurses and vaccinators are excited that it'll become one shot stop kind of sense. So that is in the works, and we're excited about that. Testing at the ranch. No, Paul won't be at the ranch, but we are working on an agreement. This is just good new information with a contractor to help provide 5 days of testing for PCR. Right now, with my limited team, we're able to do it 3 days a week, only half a day. So we're hopeful in the next 2 weeks to roll it out where it'll be in Loveland and Fort Collins, location still being determined, where we will be providing testing here through the health department's contractor 5 days a week. That'll be exciting. So hopefully in the next couple of weeks, we'll make sure we get a media release out to that. But our testing opportunities and capacity should be increasing here within the next couple of weeks.
Thank you. We also have a question from Senator Ginal.
Thank you. And right on target, because we're talking about testing. And I just wanted to maybe help you clarify to our listeners, Tom, about PCR and how do we test for this variant? PCR is a pretty expensive testing procedure because it does look at messenger RNA and the variant, in this case, the Delta. I looked at all this when we first came up with the wild strain and with the alpha strain and wondered, all right, what's the difference here? So can you explain to everyone, the Delta variant, how it's detected through PCR? Obviously, we're not able to do PCR on everybody because of the expense. So how many test positives do we do to test for the Delta variant, if I'm making myself?
You are, Senator, and that's a very good question. Lots of questions around that. So one, I want to step back. It was last year about this time we were struggling with our labs throughout the state on turnaround time. And it was complicating getting our tests back. It's taken 10 days to get your results back. Well, you can't do contact tracing when it takes 10 days. We partnered in a wonderful contract with Colorado State University's vet diagnostics lab. Folks, what we did in about 6 weeks, we turned a vet laboratory into a human laboratory. That's not easy. And they did it. CSU is a fantastic partner, and they've been running all of our community-wide tests since then, over 35,000, I believe, maybe more. But it is a very complicated scientific test, and it's not perfect. And it's got these cycle loads and et cetera. But what we do is once you have a positive, early on, the state health department would take a percentage from every lab throughout the state, and there's hundreds of labs that are doing the PCR now, and they would do what's called an S drop. They would determine that S drop and determine if it's the alpha, it's the lambent, and in April, we started seeing the alpha, and it kept going, increase. Percentage-wise on all these labs that would submit a percentage of their positives to the state lab to do this S drop. Well, about late June, early July, we started seeing Delta start creeping up, and recently it's 100%. Any sample that gets sent to them when they're looking for the variant, it's the Delta. And it's slowly gotten to where, probably don't even have to do that anymore. We pretty much certain it's the Delta. It's out competing every other variant, and that's how they do it. But it's a small percentage of every lab that they try to take in, and then they produce a percentage per region. And our region's been at 100% Delta for 3 weeks now. I hope that answered your question, Senator.
Thank you, Tom. I think it did. And so I guess my question about the other variants, the alpha strand, for example, so that we're not even seeing that anymore because Delta has just completely taken over that DNA, well, that strand of RNA, basically, or DNA. And so that's pretty much a done deal. We've moved on to this variant.
Yeah, correct.
Thanks.
Thank you, Tom, and thank you, Senator. We've all experienced a lot of impacts in regard to COVID. Personally, many people have lost really important members of their family. This has been quite an event for our nation and for the world. Another major impact is to our economy and into businesses. And so this question is for not only the legislators on the call, but also for you, Tom, as well. What is being done to make sure that our business community has very clear guidelines, and how are they being supported, since now we are now seeing this new wave of Delta coming and a lot of information coming out, and how do we kind of support them and keep them current as they're vital to our community?
Well, I can certainly, from a public health lens, you know what was something that was a silver lining back in December when we were in red and it was very dark and very difficult, losing lots of life, and my heart goes out to all the lost life in the families due to this deadly virus, is our Level Up program. Over 400 businesses stepped up and said, we're even going to go above and beyond, and got certified through us and the chambers and the Economic Workforce Development Center. What a partnership. Well, those 400, they still meet with us. And in fact, this Monday, met with our team and said, what can we do to put together a program to set, not, like Level Up, but we're Delta certified. We want to be somewhere we're taking extra precaution. We're requiring face coverings indoors. We've got good ventilation. We're doing things. So we're putting that program together, and that's driven by the businesses. And that's what we want it to be. And we're stepping back, we're giving good guidance, and they're coming up with great ideas. And they've been they've been very, very creative throughout this. I mean, go downtown Fort Collins and Loveland, and how we dealt with it, or restaurants, especially during the winter. And they're coming up with creative, great ways. So I think we're going to continue to do that. We're going to continue to support our businesses. If it's a Gold Star that they're taking extra steps, we're going to encourage people to go visit that establishment, encourage others businesses to come along, or like our rec centers, our gyms. They've been doing the same thing. They're calling us going, Tom, what do? We want to make sure it's safe. We're getting a lot of that, and it's exciting. And that was through that Level Up program. We're going to continue some version of that moving forward with Delta. So on our end, we're excited to continue that wonderful partnership with our businesses.
Thank you, Tom. Legislators, do you have anything to add in regard to supporting businesses at this time?
I'm happy to chime in briefly in that just a couple different angles on this. One is that I know Senator Hickenlooper's office and Senator Bennett's office are also working with businesses that have received that Paycheck Protection Program loan, which has been really a vital bridge for a lot of our local businesses and nonprofits, on working them through the process for how those loans can be forgiven. Many of them are eligible for that, but if you're not a large corporation or business, oftentimes navigating that process is difficult. So I think that's one thing that we can do to support local businesses and nonprofits here in Northern Colorado, to make sure that if a business or nonprofit is eligible for that loan to be forgiven, that they have the resources to be able to do that. I think that's vital. And then the other thing I would just mention in relation to this, and Tom, this is something you've highlighted for us, and I want to call it out here, is that just a small change in our behavior not only helps to keep our communities safe, helps to keep our hospitals under capacity, which is where we want them to be. I also think it helps our local business communities stay open and avoid some of these more drastic measures. I mean, and that's for me as simple as wearing a mask, utilizing outdoor spaces for frequenting local businesses. I'm often at the patio and Avos with my colleagues and other folks, because it's a safe space to gather with distance in between, and we can support those businesses in the same time. So I'm looking for those opportunities, and I would just encourage our community to do the same. Wear your mask when you go into the store. Wear your mask when you go to, Pringles or wherever else you're going, on a Friday night to pick up a bottle of wine or something. Keep those employees safe, keep our businesses safe, and let's keep them open.
And if I could just add, the Office of Economic Development and International Trade, or OEDIT, it's a terrible acronym, but they have a website, and I'll try and pop it here in the chat in a minute. Oh, I'm not sure I can, but somebody who can chat to everybody can put it out there. But basically, they have a website with a lot of different programs that are going on in regions throughout the state to support businesses, and a lot of things that we did in the legislature during the last session and the session before, really, were to try and give breaks to businesses, or help them create like the outdoor spaces, so that there were better spaces for them to be able to do business. Like, a lot of restaurants have expanded their patios, etc. So just those are some of the things we're doing, and I'm going to go try and find that website and pop it in the chat. And I think Senator Ginal wanted to chime in too.
Yeah, you guys beat me to the punch all the time there. That's okay though. I like it. I just wanted to say that what we started last fall was excellent, and I think a lot of people appreciated that. And I'm going into businesses now, or even going grocery shopping. I'm seeing a lot more people, including myself, wearing masks inside. But I also see in the smaller businesses that there are a lot of signs up on the door, please wear your mask inside. And that's I don't see why people wouldn't want to comply with what that particular business wants, because they want to protect everybody, not only their own personnel and themselves, but everybody who comes into their business. So I'm seeing a lot more of it, and I it's a small ask to wear a mask. Interesting. Small ask to wear a mask. If it's requested in a business, and I can see the benefit of it, and I hope everyone else, I know most of you on this call can see the benefit of that, but I hope the general public will also understand. So this just protects all of us.
Thank you, Senator. We have a hand raised from Lisa. Lisa, would you like to ask your question?
Hi, thank you. Dr. Gonzales, last year, 2020, the number of flu cases was dramatically lower worldwide. Are we expecting more flu this year? And if so, why?
Thank you for the question, Lisa. Yeah, it was drastically less. We only had really 3 hospitalizations for flu. We usually have, over 60 to 80. So face coverings also work to, and everything, pertussis, all that was much, much lower what we saw. What we're seeing, we always watch the Southern Hemisphere because they're a little ahead of us to see what is going on with influenza. And then for us, influenza, not seeing any real heavy spikes or any real significant increase in the Southern Hemisphere. We are seeing respiratory illness, especially in our youth though, and our children. And that's really concerning as you're hearing hospitals around filling up with that croup and those kind of things. So we're really trying to keep an eye on that. But right now we're not seeing that indicator from the Southern Hemisphere for the influenza. It's a little bit more severe than it was last year, probably due to relaxing of the face coverings and social distancing. But again, we're going to certainly recommend everybody get their flu shot so we don't have a flu outbreak in the middle of a pandemic as well. But certainly we'll have those flu vaccine clinics available here within the next month or 2.
Thank you.
Thank you.
Another question, Tom, is right now there is a lot of information and a lot of sources of information. World Health Organization, CDC, Surgeon General, local health departments, state health departments. And we've also seen sort of the byproduct of sources of misinformation on very popular social media platforms. So, Tom, could you talk to us a little bit about what are good sources of information that people should be referring to? And what are some steps to kind of check a little bit? Because like we even have groups out there that are saying they're questioning germ theory and these type of things. So kind of a 2-parter. Where should we go, and how do we kind of check these sources of information to make sure that we're getting good information that is guiding us along the right path?
Clint, that's just a very important question. It's the misinformation has really hampered our efforts in this pandemic. So much, in fact, the Surgeon General put out a 32-page paper on how misinformation is actually hurting the national security of the United States of America. And in that, we'll get the link here, talks about how you find credible sources. And the big one is, when I always look at what's the author, was it peer reviewed, if it's data, and it's hard in a pandemic to get peer reviewed, but there should be some methodology following the scientific methodology. So we look for that. We make sure that it's a source from CDC because they have to do that, to our state health department, our partners. But we always are checking who's the author, where's the source, has it been reviewed, is it following the scientific methodology? And within the Surgeon General's report, I'll put that here after I stop talking, he gets into that and what you should look for. But certainly we are hearing a lot of misinformation, stuff that's very concerning, even like treatment if you have COVID-19. Some of that stuff can actually cause way more harm than others. And certainly the one treatment we do have right now is monoclonal antibodies. That is an improved treatment, and it is working, and PVH is using it. That is on our website now. So we're trying to make sure we are only getting credible sources that meets those standards on the scientific method on our website. But I think those are kind of the 3 key elements. And as I stop, I'll find that link because I have it on my dashboard here for that Surgeon General's report.
Thank you, Tom. As we're coming near the end of our hour, Tom, one more time, how can people get in touch with you?
Well, let me get that back up here again for you. Let's share the screen. Right there, you all see it? Yes, so the 498-5500 number, that's a good one. And then the text, like I said, when you have somebody following the text, if you have a quick question about vaccine or testing or whatever, text or go right to emailing us. That's you will get somebody there to answer your questions.
Tom, thank you again for being so generous with your time this morning. This has been excellent. Thank you all for asking questions. We weren't able to get to all of them, but please reach out to Tom and his team because I know that they want to get the right information out. So again, thanks, Tom, so much. Now for some closing comments, Senator Ginal, would you kick us off?
Thanks, Clint. And I just want to say thank you to all of you that have been on this town forum this morning. I think it was extremely helpful, I know to me, looking at the dashboard again and seeing those numbers go up. But I want to thank Tom Gonzales. You have been working hard for us for the last, I don't know, two years plus. And I can't imagine all of the long hours and sleepless nights you've had working with everyone that you have to work with, including us down at the Capitol. And I really appreciate you. I appreciate how you've kept all of us informed and how you continue to do that through all different means. And this is just one of them. But thank you. And everybody stay well. You know, this too, we will conquer. And we just need to make sure that we're getting the word out to everyone. So I hope you all stay healthy. Thanks.
Representative Kipp.
Yeah, thank you so much to Tom for doing this today and for Clint for moderating. We really appreciate it. And thanks to all of you for coming. I wanted to just remind everybody that we are doing, Joanne and Andy and we are doing basically twice monthly listening sessions. Right now, we have yet to decide if we're going to do one last in-person out on a patio and on September 11th. That'll be either in person or on Zoom, but it'll be outdoors. The rest of them will be on Zoom because we can't plan the weather that far out. So just to know that is when somebody said, well, who's listening to who? Well, we're listening to you. So if you would like to come and be listened to, feel free to stop by one of those. And we'll also be doing another forum in September with our county clerk, Angela Myers. So you can ask any election questions that you have because we do have an election coming up in November. Thank you so much for coming today. We really appreciate everybody.
Representative Boesenecker.
Well, thanks. And thanks to Clint for moderating today. Really appreciated guiding us through this discussion. And Tom, to you and your team for all you continue to do in this public health space. It's been a time like no other, and we're certainly grateful for your leadership inside of this, trying to keep our community as safe as possible. I wanted to just call out a couple things briefly in closing, and that is simply just to wear your mask indoors when you can. I mean, it really is a simple thing, as Senator Ginal said, a simple ask to wear a mask. I love that slogan. I think we're going to market that one, just to keep other folks safe. And then, you know, if you're on the fence about getting the vaccine, talk to a trusted medical professional about why that vaccine is a good option for you, or bring your questions to them. Those one-on-one conversations continue to be so important as we work through vaccine hesitancy in our community. And then lastly, just a slight change in behavior. Wearing that mask for now, I think, can really do a lot to decrease the load on our hospitals and make sure that they can provide the treatment, not just for COVID patients, but for folks who are coming to the hospital for all the reasons that people come to a hospital anyway in our community, to make sure that they have the capacity to care for our community like we know that they want to and need to. So I'm grateful for this time together, for all of you for attending, and certainly, Tom, please do, if there's anything we can do to support your efforts, I know you'll keep us in loop, and we're happy to do so.
Thank you so much. Thank you, legislators, for creating this forum for us to talk about such a serious subject. Thank you, Tom, for all of your support. Thank you, frontline workers everywhere that are going through this process. And please contact your healthcare providers if you have any questions about the vaccine, or reach out to Tom's team. And I also want to thank Flint for being such an awesome co-pilot this morning and helping me out with this forum. So with that, everyone, please have a good weekend and don't forget that mask. Thanks all.